I fortunately surfed the net and I looked for a clinic that could offer me stem cell treatment.
I was more talking about how you got your stroke. How it started.
First of all, I was working in Kuala Lumpur as a restaurant manager, and 5 months into my contract, the stroke hit. I was suffering, without my knowledge, hypertension quite high. So that resulted in the stroke, which was pretty soul-destroying for me. To have a very active, progressive life taken away from you was very hard. One of the things that hit me the hardest was depression, and it came down like a hammer. And I had psychological treatment to overcome this. Fortunately, I negated the use of strong drugs, which I didn't want anyway. So I got over that. So I had rehabilitation in the hospital in Kuala Lumpur for 1 month, and then I was allowed to transfer back to Australia, where I was in hospital for a further 2 months, one in the hospital and the second month in what they call a halfway house, which got me back into a situation where I started to work for myself. I was still confined to a wheelchair. And that's pretty hard when you've led a very active life to be confined to a wheelchair. It's not easy, but you have to do it. You have to do it. So I managed to progress from the wheelchair to able to walk with a cane. Not well, but I was determined that when I left the hospital I would walk out on the cane, and I did. But of course I was still confined to the wheelchair, outside of walking. Then I had continual rehabilitation in Canberra, but I wasn't happy. Unfortunately, the doctors in Australia, be it through a number of reasons, did not know about stem cell. Or if they did, they thought it was something that was science fiction. So it was never given to me as an option. I elected to go back to Vietnam, basically because I lived there for 17 years, so it was now my second home. So despite family influence, I went back. I continued my rehabilitation in Vietnam. I found some very good doctors, a very good acupuncturist, in fact 2 of them, and physiotherapy was continued. At that point, I decided to go surfing on the net. I thought there's got to be a better way. There must be a better way. And I was aware of it. I asked for information. Everything I asked for was given without any hesitation. I sent that information to my doctor in Australia. He also researched the clinic and came back and said, do it. Do it. So I did. We won't go into the costs at this point because I don't think it's necessary. But suffice to say, I made that choice. I did. Nobody else. I did. So you can probably understand that on my arrival here at the clinic, there was a certain degree of apprehension. I wasn't sure what was going to happen, how it was going to happen, where it was coming from, I didn't know. So there was apprehension. That was dispelled in one day. Totally dispelled. Everything was made extremely categorically clear to me on what the treatment was, how it would be administered, and what would happen to me during the 5-week period. I have been able to achieve in the 5 weeks I've been here through intense physiotherapy, which happens 3 times a day, whether you like it or not, but you have beautiful physiotherapists that take care of you. So you have 2 courses of physiotherapy, one of occupational therapy and of course the stem cells. So by the time you leave the clinic, you are physiotherapy to occupational therapy to death, and you are 20 million stem cells richer. That 20 million stem cells to me has given me the ability to walk much better than when I arrived. I couldn't believe it. I do not use my cane. I don't. I walk everywhere. I walk slowly up and down stairs. The stem cells don't say, that's it, it's all over. they will continue to work, and the improvement will be incremental in the next month, the next month. So in 6, 8, maybe 9 months' time, who knows, it depends on how they react to my body. I could have the greatest Christmas present at that time.